Shoveling is a very big part of our Canadian winters. So I brought my shovel and I'm here with Grant Lum, sports medicine doctor here in Toronto, who's going to give me some tips.
Well, thanks for inviting me out to shovel, Kelly, as if I didn't do enough this morning.
Exactly.
I wanted to talk just really quickly about a couple of major things, one of which is, as we always tell people, we don't want them bending at the back. So this type of thing where people will lift snow up like this, that's very bad on the back. Instead, if you get underneath the snow, bend with your knees to lift, that makes it a whole lot easier. The second big thing is that people will typically throw snow, to the sides of their driveways or something, but they'll throw it behind their back or they'll throw it way across, something like this. And that twisting action is going to cause a lot of damage to the back. So we want them to lift and hopefully throw more out in front of them so that they're not really having to twist. The last thing is that because I'm right-handed, I tend to like to shovel this way with my left hand lower. So if I tend to swap around and do this and twist the shovel in and turn the other way, if I have to turn, that's going to decrease the amount of stress on my back because I'm alternating sides. I'm using both sides of my muscles.
So that covers the back issue, but we often hear during the winter about people who suffer from heart attacks when they're shoveling. Why would that be, and why is this a strong message to put out there?
Well, shoveling is a very heavy physical activity. It's just like lifting weights at the gym or lifting weights in your basement or whatever. And the problem is that most people are not fully prepared for that activity. People are not in the physical condition to be able to do it. Particularly people who've had heart attacks or other heart problems before, they're really at risk. But in fact, if we look at the statistics, there are a lot of people who'll have heart attacks from shoveling who've never had heart problems before. The main way to try and avoid that sort of a problem is, number one, to make sure that you've had a proper checkup with your family doctor, make sure that you don't have any sign of heart disease, manage your risk factors like smoking, like your weight, like regular exercise, all those kinds of things, blood pressure. If all those things are in good shape, then it's a lot less likely you're going to have a problem. And then when you are shoveling, try and do it slowly, give yourself a lot of time, pace yourself, lift very small amounts of snow at any given time. Don't try and do the whole thing within 5 minutes, and that's going to help you as well.
Well, how important is this? Because it seems like we forget these shoveling tips year after year.
The unfortunate thing is that when we look at the stats, every single year there are hundreds of people who will have heart attacks in relation to shoveling. And when we look historically at years where there are big blizzards, the number is even higher than that. So it's really important for the public to understand that all of us are at risk. Men over 40, women over 50 in particular, those are the ages where heart attacks are most common. We want to make sure that people in those age groups are being really cautious about this.
Well, one other tip I like to put out there is you can look at the type of snow we have. Like, for example, what we're dealing with is more heavy and it's dense snow, whereas if you get fluffy snow, it's a little bit easier.
Yeah, that very light snow when the weather is really dry, that's a lot easier to lift and it's a lot less dangerous. This packing snow, great for my 3-year-old making his snowman, but terrible for us who have to lift it off the driveway.
Well, Grant, thanks for spending time with us. I'm Kelly Noseworthy in Toronto, learning how to shovel.